is an unprecedented opioid crisis in America. The Trump administration is fully committed to reducing opioid deaths and addictions while increasing treatment and recovery options.
Drug overdose is now the leading cause of accidental death in the United States, and opioid overdose deaths have nearly quadrupled since 1999. It is a problem the likes of which we have not seen.
No state has been spared and no demographic group has gone untouched. This is not a problem of young or old, of black or white, of rural, urban, or suburban. It really has affected all of our communities in varying degrees.
The numbers tell a tragic story of devastating magnitude. Over 100,000 deaths related to opioids in the last 3 years. Yet there remains a tragic belief that prescription pain relief drugs are not dangerous.
Every 20 minutes, a person dies of an overdose from a prescription opioid. Every 20 minutes.
Opiates are not a drug that you sample or try or experiment with. They can be addictive and even fatal on the very first dose.
If you look at the data, if you look at the statistics, a majority of people who are accessing prescription medications for non-medical use are actually getting them from family or friends or other sources.
For some people, it just takes using an opiate 1, 2, 3, 4 times before they become addicted, because addiction is a disease. It's not a choice for many people.
The Department of Health and Human Services is increasing resources for the very important treatment, recovery, and prevention efforts happening at the state and local levels. The Trump administration believes that those who are closest to those in need know best how to help them.
To me, the rubber hits the road with community and community coalitions, and that's why partnerships with different stakeholder groups makes it just so essential to help take some important research-based concepts, such as why addiction is a disease, and help translate it so that people appreciate it, understand it, have an opportunity to talk about it. I think it really just shifts how we approach policy and practice.
We've united across the nation to come together to support and celebrate the idea that recovery works, treatment is effective, prevention is possible, and to come together to show the world that we're not hidden in church basements, that we're not hidden in any other parts of the country, that we can be out in the open, and showing the world that this whole thing, this whole rally, this whole community is important.
Our hope for prevention, treatment, and recovery of opioid abuse lies in our confidence that the wisdom and resources to heal and recover already exists in congregations and communities around the country. Our goal is to come alongside you with new skills, educational opportunities, and resources to advance local efforts and help build the capacity of your community to respond to this opioid crisis. We will walk alongside those making the journey on the long road to recovery.